Rethinking the Relationship Between Addiction and Choice, an informative comprehensive commentation from Harmison. As a practicing journalist, and as a pre-licensed psychologist, I do not argue that psychologists take reasonable steps to avoid harming their clients' patients. This quote represents the 2017 edition of the APA Ethics Code. Furthermore, the Society of Professional Journalists have codes of ethics that emphasize accuracy, fairness, and impartial reporting. In order to give my full unabridged opinion, I must conform to these standards. In regard to my relationship and understanding that was presented by Dr. Wilbur, who attended Loma Linda University studying cell physiology and the University of Utah studying biomedical engineering. Addiction and choice are inextricable, they are intertwined. The proven case that addiction is a choice, and not a disease, is the vision of Dr. Wilbur. Dr. Wilbur explains that understanding choice is to also understand free will. This is fundamentally the foundation pertaining to the topic that choice is the ability to have acted differently than we did, all other things being the same, and free will is the ever-present sense that as we move, we are the masters of our limbs. To continue that thought from that quote, if society has decided that individuals determine the route in which they administer the drugs to themselves, then movement is freedom, so how free are those addicted individuals, and do they have other options? If addiction is viewed as a model of disease, then one is to say that being sick is the addict's excuse. If the addiction of the addict follows the moral model, then it is also a choice to indulge in sinful activities. So is it presumptuous to rest the case that addiction is a predetermined, predestined outcome for drug users to become addicts if it coincides with the models discussed? Physicists, atheists, and philosophers disagree with the choice model due to genetic disposition, environment, and childhood trauma. Dr. Wilbur agreed that free will is a spectrum called hard determinism. Hard determinism is discussed on the far left of the spectrum, derives from no compatibility. Importantly, hard determinism is having no freedom due to it being non-existent. Moral decisions are controlled entirely by external factors. Towards the middle of the spectrum is soft determinism, with the idea that human freedom is limited by some external factors. Soft determinism addresses the primary responsibility upon the individual that may be limited by external factors. To the far right of the spectrum is libertarianism, action theory, and existentialism. This is the end of the spectrum, and is described as having complete control over your choices despite external circumstances. Dr. Wilbur's argument is that addiction is a great example of how our free will is limited. Free will is limited due to existential circumstances that places a strain on the addict's freedom of responsibilities. People equate the disease model with the introduction of fatalism of addiction. Fatalism is defined as belief that events are decided by fate and that you cannot control them, the fact of accepting that you cannot prevent something from happening. This quote illustrates the complexities that fate can have on the mental psyche that can lead to psychosis. This mental anguish of the addict that compels the addict to use compulsively is substance-induced psychosis. American Addiction Center has defined substance-induced psychosis as a mental health condition characterized by transient, severe hallucinations or delusions directly caused by the ingestion, intoxication, or withdrawal of drugs, alcohol, or medications. This quote describes substance-induced psychosis, and the study of the physiological effects of drugs on the body, that is, the pharmacodynamics. Pertaining to the pharmacokinetics, drug consumption is driven by a drug's pharmacological effects, which are experienced as rewarding, and is influenced by genetic, developmental, and psychosocial factors that mediate drug accessibility. This quote represents Harmison's understanding of the relationship between addiction and choice. 2. Following the argument that willpower is a direct component of choice drive. Wilbur illustrates willpower as a conscious, effortful regulation of the self, by the self-determination and drive. This quote emphasizes that addicts do not set out to become addicted. Substance-induced psychosis is a lack of response to awareness, and is a self-action of performance that is derived from unregulated firmness of resolve or purpose. As a resolution, psychologists address the lack of ability to delay gratification. This quote reinforces the argument that actions of an addict cannot act in a manner of constraint due to the postponement of a lack of skill when faced with emotional pleasure. 3. Despite a reduced response that an addict may be experiencing in relation to the decisions to quit. Viktor Frankl, the Austrian psychiatrist and Holocaust survivor, wrote in his book Man's Search for Meaning, a poetic yet philosophical viewpoint. Frankl's text reads, that between stimulus and response, there is a space, and in that space lies all our freedom. This text pronounces the segments of gaps within the addicted individual's life experiences. These gaps harness the opportunity of change that can lead to better circumstances. IV. Informatively practical, research indicates that a significant portion of individuals with substance use disorders recover without formal treatment, often referred to as natural recovery or self-change. Studies show that over half of people in remission from addiction achieved it without attending formal rehab or treatment programs. This quote contributes to the compounding effect of utilizing willpower and choice simultaneously as it relates to the decision to quit. The National Institute of Drug Abuse addresses concern in regard to individuals suffering from addiction with underlying psychiatric disorders and co-occurring disorders. Research suggests that addicts with co-occurring disorders and psychiatric disorder make up approximately 50% of individuals with a substance use disorder. These individuals also have a co-occurring mental health disorder, with rates often higher in treatment-seeking populations. Over 50% of drug abusers and 36% of alcohol abusers have at least one mental health problem. This quote displays the urgency for aid to be administered in the United States in regard to mental health disorders with underlying causes. Dr. Heyman, renowned for providing extensive research on the understanding of addiction. Dr. Heyman, a psychologist who practices at McLean Hospital, and is a visiting associate professor that lectures at Harvard Medical School and Harvard Extension, describes the controversy as a lack of understanding. Dr. Heyman, who wrote the book in 2012, labeled Addiction a Choice, explains simply that if the concept of addiction and choice were explained as it relates to his vision would not be deemed controversial, and perceptions could be swayed. Dr. Heyman explains that the APA definition of addiction is fundamental within the doctor's vision that states, a state of psychological and/or physical dependence on the use of drugs or other substances, such as alcohol, or on activities or behaviors. The term is often used as an equivalent term for substance use disorder or substance dependence, and can be applied to non-substance related behavioral addictions, such as sex, exercise, and gambling. A chemical substance with significant potential for producing dependence is called an addictive drug. The definition contributes to the usually controversial concept that allows the addict to overlook genetic disposition, and this within itself motivates addicts to stop using. Predispositions can have positive influences such as to be a piano or baseball player. This does not suggest that said individual will become, or have the influence to contribute to that talent. Dr. Heyman suggests that liberation from predisposition can influence an outcome before the action takes place. Predetermination by rearranging decisions in advance reduces the action of contemplation, and establishes a firm action within the addicted individual to quit. 7. In conclusion, the vision of Dr. Wilbur understanding of choice is to also understand free will. That within this foundation of choice fundamentals can aid in the ability to have acted differently than we did. Dr. Wilbur illustrated how the driving determinations are dictated by one's own self-regulation with emphasis on conscientious effort. Notably, government funding for treatment within society can encourage addicts to choose self-control over self-destruction. The just persuasive dialogue provided by Viktor Frankl, that freedom lies within a space between the responses to stimulation, can indeed help to persuade and foster growth within tight-knit communities. Ethical norms as discussed by Dr. Heyman need no longer to be controversial due to the positive nature that the material presented reserves. Putting aside genetic disposition creates a gap for morality to ensue. Factors such as predetermination leads to actions that break compulsive behavior, and leads to a gratifying corporeal existence. Works cited in the description.